I'm going to talk about perfecting our acne treatments with energy-based devices, and this is a new treatment model for treating acne. How many people here have energy-based devices that they commonly use for treating acne? All right, so we have a couple of people. So after this talk, hopefully you'll be more comfortable with energy-based devices for acne. Acne is a huge problem in the United States and also globally because it not only affects teenagers, it affects adolescents and it affects women, especially with hormonal acne. And it's not just what we see on the surface that bothers people, it's everything that comes with acne. It's the psychological impact of acne. And we know from so many studies that acne is linked to psychological disorders and in particularly depression. So it's important for us to treat acne effectively and shorten the duration of our acne treatments. What we currently have now is patients come in, they get diagnosed with acne, we prescribe them various medications, and then we wait and see. The waiting can get a little bit tiresome, and for me, I'm not a very patient person, and with my patients, I even tell them that, like, I'm not patient, but I'm gonna ask you to be patient and to give 8 weeks, 12 weeks for whatever I prescribe for you. What we do now is we identify the kind of acne that the individual has. We come up with a list of topicals and oral medications that they need. And also, in my practice, we identify what procedures would be helpful. We have an outline of mixing the orals, the topicals, along with the energy-based devices. And then there's a lot of counseling with the side effects of the medications that we're prescribing, but also the side effects from the procedures that we're gonna do, and then the risks associated with all of these. And why do we need to readdress acne or have different plans for treating acne? The main reason is that our patients are more sophisticated. A lot of them don't want to take oral medications because they're afraid of the risks, of the side effects, especially with oral antibiotics. They don't want to be on them for long term. And also with Accutane. Accutane is fantastic. I think it's the closest thing we have for a cure for acne, but it comes with a host of side effects. And when patients go online and they see all the terrible things that can happen, they're not as willing to go on a course of Accutane. And then with patients who have skin of color or who are darker skin, they get hesitant about some of the medications, some of them making them sun sensitive, having more PIH, more post-inflammatory erythema. And this issue with discoloration and managing discoloration becomes more of a problem. So one of the problems we have with the traditional models of just doing topicals and just doing oral medications, one is that this doesn't really change. I started my training over 15 years ago, and not much of this has changed in that time period, and it takes a while for these medications to take effect. Another problem is people are non-compliant. I'm pretty non-compliant with oral medications, and what you notice is that over time, patients become less and less compliant with their medications. And with the changes with insurances, it's also becoming more expensive to fill a 30-day supply of your medication. And what we've talked about and I've mentioned is that it takes a while for these things to start working. People are impatient, and I feel like the next generation is more impatient than our generation, so they want to see results, and that's what's going to retain them as patients in your practice. This is just the traditional model that deals with, and it's a busy slide, just dealing with how we approach acne and how we have the different algorithms for what combination we give them. But one thing we don't really address while we're treating active acne is what about all the complications and all of the other side effects that can occur, like with the discoloration, the erythema, and the scarring? What if there is a way where we can manage their acne and also minimize their risk of side effects while we're treating the patients? And I think that this is where combination treatment with devices comes into play, where we're able to manage the acute problem, but also minimize the risk of complications as a result. So we're moving from the wait and see approach to doing things at home, but also having patients come more frequently into the office so we can treat their acne and also treat some of the side effects from their acne more regularly, and we get to see their progress in the office. Before, we had many light and energy-based devices that were being used for acne. You can all see the list here. They were all very selective. They had the side effects, and what I think didn't pick up is the popularity of using all of these devices regularly to treat acne. The newer devices really focus on targeting the sebaceous glands. So we know that the sebaceous glands are the root of what's causing the problem with acne, and the newer devices, the ones that have come out targeting the sebaceous glands with the 1726 wavelength, have been very effective in shrinking the sebaceous glands. And then there are also other devices like the Aerolase, which also help target the sebaceous glands. So here you can see the top device is a 650 microsecond ND-YAG, which is the Aerolase device. And what it does is that it does target the sebaceous glands to reduce sebum production. It also has great anti-inflammatory effects, but also it kills the P. acnes, which is contributing to acne. And then now we have two new devices for acne that have the 1726 wavelength, and what that's doing is just selectively targeting the sebaceous glands to reduce acne. What I want to focus on is what we do with the complications from acne. So we've talked about the medications and how patients don't like taking oral medications and there's more resistance to that. But what about the complications that occur, such as discoloration, erythema, scarring? One thing that I like in particular about using the 1064 microsecond pulse ND-YAG is that I'm able to address the erythema, the discoloration, along with treating their acne. And that's what makes patients happy and satisfied with the treatments. There have been many studies done by the company that shows the efficacy of this treatment. So this was a study that was done just with a sham, and you can see that the inflammatory improvement is huge. There was a 400% improvement in the inflammatory lesions compared to sham treatments. And also there was a 100% reduction in sebum versus sham. So here you can see that we're getting improvement in the patient's acne as well as the PIH. And for patients with skin of color who are Asian background or Middle Eastern background and African American, that PIH from acne can last for months. For myself personally, if I have a acne lesion, that PIH could persist for 6 months. And that's actually more concerning than the active acne itself. And here we can see great results. And this is after one treatment with a significant improvement in the active acne, but also in the PIH associated with it. There's a study that was done looking at patients who were taking a low dose of Accutane and then onboarding the Aerolase treatments with their low dose Accutane, and it was significant because the patients had quicker resolution of their inflammatory lesions, but also an improvement in the existing scars. I find that when patients come to the office and they're willing to take all the steps to go on Accutane, they're highly motivated patients. So if you can target those patients to also do an in-office procedure while they're on the Accutane, they're really happy because they're seeing more rapid reduction in their lesions. And here's a patient, and you can see that after combining the Aerolase treatments with the low dose of Accutane, there's so much improvement in the post-inflammatory erythema and the scarring that was starting to develop. And here you can see that a little bit more zoomed in. Dr. Ortiz had done a study looking at the efficacy of using the laser in conjunction with topicals for the treatment of acne, and what she found was that there was a significant improvement in the patient's inflammatory lesions, but also in the appearance of the PIH and the erythema. Here are just some more pictures showing the reduction in acne, but also in the erythema. We had recently conducted a study in our office doing a series of treatments, 6 treatments, 2 months apart, for patients who had mild to severe acne. The patients were only on topicals, and they had significant improvement in their inflammatory lesions along with their erythema. And here you can see this is a patient who was 3 months after 6 treatments, and there's significant improvement. Here's another patient who refused to go on any kind of oral treatment, and you can again see improvement. I think that patients who are darker skinned were the most thrilled to have these treatments, because so many of them are hesitant to do laser treatments because of fear of scarring or side effects. But what we found with this is that there's a significant reduction in their discoloration along with acne clearance. And here's a picture of a patient that Michael Gold had treated, and this is after 6 treatments, and this is a patient who had failed treatments with Accutane, and you can see significant improvement. And with that kind of inflammatory acne, you would expect to see much more severe and deeper scarring once the inflammatory lesions resolved. And here's the Asian patient, and you can see again significant reduction and also no scarring as a result. I like using this device for patients who struggle with acne along their jawline. Some patients don't want to take spironolactone. They have too many side effects from it. And with these treatments, they do see significant improvement, and there's also some component of hair removal as well. So these are just more pictures indicating the effects of the acne, but also the improvements in the post-inflammatory erythema. And overall, these procedures are very quick. Personally, it takes me about 10 minutes to do the treatment. I have patients come in every 2 weeks, sometimes every 4 weeks, and I like to do 4 to 6 treatment sessions. And in our office, we charge more than the average price that they have listed here, but patients come in more regularly. They're happy to see the improvement. We take photos on the Vizia so we can track their progress of their acne and their scarring along the way, and for the most part, there's minimal pain, and patients tolerate this so well. So overall, this is a really easy device to incorporate into your practice, just because acne is so common and patients are looking for other ways of treating it besides going on oral medications. Thank you so much for your time. I'm more than happy to take any questions.